The bathroom safety equipment hasn't really changed since the early 70s. It's a flat surface. 80% of the more serious accidents that happen at home happen in the bathroom. And I think this is a large part of it, is the equipment. The individual can actually take care of themselves longer and keep their dignity, and because they don't have to stand in the tub or the shower in soapy water.
Today's conversation is with Vince Ehrenberg, CEO of PeriChair. But that title doesn't tell you the real story. Vince became a caregiver overnight when his father's health declined. And like so many adult children stepping into that role, he quickly realized the bathroom safety equipment available was stuck in the 1970s, clunky, unstable, and fundamentally unsafe, especially when you consider that most serious accidents for the elderly happen in the bathroom. So Vince did what few caregivers have the audacity to do. He invented a better solution. The PeriChair isn't just a modified shower bench. It's a complete reimagining of how we preserve independence and dignity for aging adults. His mother is 90 now and still using it daily. But turning a prototype into a market-ready medical device meant navigating patents, manufacturing partnerships, CMS reimbursement codes, and FDA regulations, all while maintaining control of his innovation. This is a story about what happens when personal necessity meets entrepreneurial tenacity in a market that desperately needed disruption. Let's dive into it. Well, Vince, hey, welcome to Stories in Life Sciences podcast. It's a pleasure to have you on today. I'm really looking forward to digging into hearing and learning more about your story. I feel like I've learned some, but just it's been a long journey to get your product to where it is now. And I look forward to you telling a little bit more about that journey. Where are you calling in from today?
I'm in Chicago.
Yeah, and let's just jump into it, get started. I mean, what prompted you to start PeriChair, and then just walk us through that process of why you created the product.
The backstory is I became a caregiver literally overnight. Father had a stroke when he was 80, and he semi-recuperated from that, but then he developed vascular dementia. So he came in with us and moved in with us when he couldn't do it anymore. As I mentioned, I became a caregiver literally overnight, not knowing what I was in for. There was a lot I didn't know that I know now. I was the only person he would let touch him because he was a tough guy. He was a Golden Glove boxer. He lied about his age to go to Korea. Then he came back, and then he got drafted. So did another tour.
Different generation.
Yeah, right.
Wow.
Yeah, these days they're running the other way.
Yeah.
He was a Chicago police officer for 33 years and U.S. Marshal for 10. So tough guy. Well, I guess he was used to be surrounded by all men in the industry at the time. But so I was the only one he'd let touch him. And so I was basically with him 24 hours a day, especially when the vascular dementia, worsened. Giving him a shower, the bathroom process was the hardest part of the day. Scariest part for him. I'd literally, towards the end, kind of have to give him a little push from behind to get him through that door. As I mentioned before, the bathroom safety equipment hasn't really changed since the early 70s. It's a flat surface. It makes it hard to clean the perineum area. I just found that fascinating, why they didn't have something to make the whole process a little easier and a little less scary for the individual. Because I think, they're vulnerable. Somebody else is washing them. They don't feel safe, sitting on this flat bench. We went through a number of different pieces. As I mentioned, I didn't know what I didn't know. So we went through a number of different pieces, I think 5 or 6 total, because we used different types of seats in the tub shower. As his mobility declined, we had to change, and I kept thinking, why don't they have this?
Were you making some of your homemade versions for him along the way?
Yeah. So I was taking the piece of equipment that we weren't using anymore and making into what I thought there should be out there, something that was a lot smarter and functional and safer as well. I took the pieces apart. I made the prototype. I cut the seats with a saw and recovered them with the foam and vinyl. And so I kind of jerry-rigged it because I didn't think it was safe enough, stable enough. I had some other supports in the tub as well. But this, again, was towards the end of his life. Last 6 to 8 showers, and they were by far the easiest. And I just found that an incredible revelation, because what I had to do is I had kids in the house as well. If my son was home, I'd ask him to come in and I'd step across the tub, lift him up, which could have been detrimental to both of us, but mostly him. And then my son would clean him and put him back down. If I didn't have any help, I'd push him down and try to clean, and he'd think he was falling and he was fighting. And so it was kind of crazy. That's where the seat design came in, where the frame has the U-shape opening. The seat is open both front and back. So the individual can actually take care of themselves longer and keep their dignity, and because they don't have to stand in the tub or the shower in soapy water to clean their bottom. I think the shower, definitely, you have to stand while there's soapy water to clean yourself. I talked to my mom's friends that were taking care of each other. My mom's friend, Paul, how are you doing this? And, he's in his early 80s and has been taking care of his wife for years. They had a chair in the shower, and she was able to clean herself still. But at the end, she had to stand up and hold a grab bar, and he had to come in and clean her behind, which, again, I think is an accident waiting to happen. 80% of the more serious accidents that happen at home happen in the bathroom. And I think this is a large part of it, is the equipment. The seat design, there's nothing like it. It also relieves any pressure on your tailbone, which is when they start losing their mobility. When he'd sat down on the hard plastic, he'd almost knock the top of the toilet tank off, I mean, you could imagine just sitting on that hard piece. And that design, I had a couple different purposes for it, and keep the individual more independent as long as possible, but then also make it easier for the caregiver as well, and safer. There's less strain, less lifting. Like I said, mentioned, we still had kids in the house, and we had this other equipment outside the bathroom. So you got a raised toilet seat, a transfer bench. So I was thinking, how can we reduce the amount of clutter as well? Really exactly how it was designed, what I was doing and what I was seeing and what I thought was needed. I saw the problem and I tried to fill the need. I designed the chair that has two wheels, so you can roll it in and out of the bathroom. It doesn't need to be carried, which I think is another tripping hazard for older people, especially a transfer bench. We had the 3-foot long plastic transfer bench, and it's not heavy, but when you're holding it up, you can't see in front of you. It's a tripping hazard for older people as well. By only needing the one piece of equipment, you have less clutter inside the bathroom. You're not going around a transfer bench to try and get to the raised toilet seat. So there's less things to trip on.
Yeah. I mean, it seems like a simple thing, but for anybody who's never had, a elderly person in the house, just to visually think about it. I remember my grandparents being at my parents and my aunt and uncle's house, and there was one piece of equipment in the bedroom. There was another thing that lived in the bathroom. There was different pieces all over the house, which it becomes clutter an issue. And also to your point, a safety issue when you're trying to move something from one place to another. It seems like you've uniquely solved taking these different pieces and made them better, but also made them all in one functionality. Is that kind of
correct? Yeah. Yes, I have one of my arms. It folds down, so it becomes a transfer bench. You never have to step in the bathtub, even when you have your mobility. From my experience, is probably the scariest part of the bathing process is that first step into the tub. You're on one foot, you're raising the other foot. So the chair prevents all that. So you can use it as a transfer bench, like I mentioned, even when you have your full mobility. To go back to the two legs that are on wheels, we also reverse engineered the wheels. They automatically lock. So as soon as you put at least 30 pounds of pressure on it, they lock automatically. I think that is really important as well. Because people that buy equipment especially individuals, what they don't know, like me.
Yeah.
The top blocks are really hard. They were hard for me, and you're balancing on one foot. And most of the time, you have your shoes off, when you're getting it ready. And for an elderly person to have to do that, I just thought was another possible fall. And even forgetting to lock the locks,
Yeah.
having a fall.
Yeah, you've thought of all like the little nuance, all the subtle little pieces as well, which I feel like comes from someone who's actually done it, not just someone
Right.
who's thinking about it in a lab or somewhere else. Why do you think that there hasn't been any innovation in that space when you dug into it and looked at it? Like,
What I see is these big companies that they just mass produce these pieces of plastic and push these cheaper items, and people think, oh, it's only $100 or whatever for transfer bench, but they don't know it's not functional until they get home. There's really no returns on these type of equipment because of sanitary issues, but they mass produce these pieces of plastic just to sell them in huge quantities and make their margin. I truly don't believe that they care. I can't say that for certain, but if they did care, I think there should have been a lot of changes along the way.
yeah,
They've created a slide bench where you sit in a chair and then you can slide, you lift your legs over like you do with a transfer bench, but then the chair slides into the tub. But now you got them in there. How do you clean them? Now they got a solid back behind them and a solid chair. Doesn't make any sense to me. I mean, I'm a little biased, but
yeah, it's okay to be biased.
it really boggles my mind that
Yeah,
that there hasn't been more creative advances. Again, with the number of falls in the bathroom, you'd think they,
yeah.
a bigger focus on that. I'm taking care of my mom now, and she's 90. She's using the chair, and I haven't had to give her one shower. That's the best testimonial I can give you.
Yeah, no, that's real. That's real. And it's been a long road since you've gotten to the point that you're at now. So I just like to
Right.
touch more on that, like the entrepreneurial journey, the iterations along the way, and then kind of a little more about where you're at now in the actual the manufacturing, the product itself.
Well, let's see. I started out with my own drawing. I didn't know that I needed the patent to keep moving forward. The patent came relatively quick, but I had to go through a number of different patent attorneys because even that's a game. I finally, and they're expensive, and because they kept coming back and saying, it's too much like this and that, and they were just regular chairs. And I kept saying to my attorney, why are they comparing it to this? This is nothing like it, Well, you got to put another claim in, which means more money. And finally, I found this, somebody referred me to this guy down in Indiana. You could tell as honest as can be, and gave me a half hour of his time without charging me. And, he said that you can challenge the drawings. They changed the law a year ago. And he said 9 out of 10 of his cases were overturned immediately. Next day, he sent me one of his cases, and I forwarded to my attorney. I'm like, are you aware of this change in the law? Oh, yeah, we are. But a couple weeks later, I got the patent. So...
Okay, so yeah, we just had a patent office actually on here a week or two ago. So I learned a lot about it's so important. And Vince just said it here: is get a solid patent attorney early on.
Yeah.
I would say Shem at Menlo Park Patents that was just on here. He started this because he was an innovator. He started his company because he found just issues like you just spoke to, and wanted to create a better pathway. So yeah, be careful early on. Choose the right. You can waste a lot of time and money.
Yeah, I think you have to do the research. Obviously, it's hard because they're going to tell you what you want to hear. So it's good to get a referral from somebody. And at the time, it was my manufacturer here. Just trying to make it here in Elkhart, Indiana, and the patent attorney was from Indiana as well. The next step was finding the manufacturer. That took quite a long time to do. because a lot of these guys say, I can do this, but I can't do that as far as the drawings and things like that. It took me at least, I would say, a year and a half. There's groups in the state of Illinois that try to keep the business in Illinois, and they have all these referrals. So I went through a number of them. None of them could do it or wanted to do it. So
Why?
I found, I don't know. Because they couldn't do the CAD drawings. They didn't have the right tools. I finally found this guy in Indiana who had the perfect facility because they can manufacture and pack and ship all in the same and hold inventory. It was a big place. I thought this is where I need to be, but the cost was just too much, and it wasn't their forte. So it wasn't really their fault. They've kind of specialized in a different sector, but not in medical care. All the big companies that I was talking to were like, yeah, this is great, but you got to take it overseas. Everything in this industry is produced overseas. So I eventually gave in, went over to China. And,
So you went over there.
Yep. Yeah.
Okay. Just to be clear, too, like all this stuff you were doing on your own, just finding this out along the way.
Yep. Yep. That's why it's taken so long. So I found the manufacturer over there, and it's been perfect. They've been great. I found the people there couldn't have been any nicer. Vast majority of them speak English. The cars on the road, 80% of them were electric. And boy, it was crowded. I was in a province of 18 million people, and it was fascinating to see how they drive. They're inches apart from everybody, but it moves,
Somehow it works, though.
Yeah, it's crazy, but they do work for other major companies. So, I felt really good. Actually, yesterday, they put the freight on board, so it's on its way.
Exciting.
So we're looking to have product here on the 19th. Last week, signed a nice contract with Adapt Health out in New Jersey. They're one of the bigger companies. They bought 3 pallets of my 15 for 3 different stores in New Jersey. And they have about 675 locations around the country. I got my foot into a good door.
Yeah, that's exciting. What a journey. And the other part we had spoke to before as well is you've also navigated the CMS pathway. That's a whole different thing, the manufacturing and the patenting, but you've also navigated regulatory aspect. Can you speak a little bit to that and just where you're at as far as having the chair able to be reimbursed?
I don't want to talk about the FDA because they charge a lot of money, and you have to re-register every year. I mean, that's crazy. It's crazy. It makes it really hard for small business. Mm-hmm. The CMS was really kind of a smooth. They were probably the easiest to deal with. I would say definitely the easiest of the 3 processes. I can't say anything negative about the CMS.
But so now you've got it's covered when that chair goes in and somebody orders it. It's covered by CMS now.
Yeah, it's covered by Medicare.
Medicare.
Yes.
Okay.
Yeah. So CMS, you have to register with CMS to get
Medicare.
the NPI number that Medicare needs, and it's also covered eligible for FSA and HSA. Oh. That's another nice benefit as well.
Yeah, and what are some of the biggest learnings that you've had along this journey? There's surprises too. What surprised you, I guess?
Well, everything surprised me because I thought I was there so many times. The finish line, I saw a light at the end of the tunnel, only to get smacked upside the head. So the whole thing was a learning process, obviously. I can't say any surprise in particular because each step I didn't know what I was getting into. So I just had to keep plugging away and read a lot.
Yeah. Well, on that note, I didn't even ask you, what was your background before this?
Originally, I was a trader down at the Board of Trade, Chicago Board of Trade. I traded 30-year Treasury bond futures. And then I left there when my first daughter was born, and because I wanted to be at home and with the kids, and my late wife was a teacher, and I had my real estate license as well. But I would say a caregiver
Mm.
from my kids up to my father, to my mother. So
And what kept you going during this whole time? I mean, you got finally got it now. You have a product shipping. What kept you going this whole time?
I have to give LinkedIn a lot of credit because I met so many wonderful people on there that were very helpful. Major company CEOs. I just met people that just wanted help for no particular reason, make an introduction, things like that. And the comments, I guess, that I got from people, everything was positive, wow, this is awesome. What a great design. That's what kept me going, that people were so supportive and positive about it.
That's good to hear. Like the online community, actually,
Yeah.
people reaching out in a good way.
Yeah.
Um,
And I know it worked for me, and I knew it was something that would help a lot of people, but it was such a long process. It was nice to get that, verbal support, like push, keep going.
yeah. And then on that, any advice that you have for people looking to create something, especially, within the medical world or space, like lessons you've learned, that things that you would maybe do differently?
Uh,
It's probably a long list.
I think I'd get the investors first.
Yeah.
But I don't think anything should be rushed either, because you have to do your research. Like as I mentioned, just about a patent attorney. I had one here in Chicago. He asked me to come down to his office, and I go down there, and he's got all these patents hanging up on his wall, and he had the first ever patent issued. It was signed by James Madison and Thomas Jefferson, and it was for this type of cloth. And I'm like, wow, that's cool. I did get that and this and that. And then I saw its prices, and I was like, oh, okay, I know how we got that. uh,
Like not the guy you want to hire when you're a young
yeah, right.
startup.
It's probably $1 million piece of thread.
Yeah. Well,
But
and on that, what made you decide to, like, as far as capital? I mean, you bootstrapped this thing along the way.
yeah,
I mean, I'm sure there's been opportunity to not or take investment. I mean, what's made you stick to that?
I do have a couple small investor people that I know,
Yeah.
that I gave some equity to. The reason why I did what I did was because I wanted to keep control of it. There's big company that I won't name that wanted to private label it, and they asked if I was willing to go overseas at the time. Would I change the name? All this stuff. And I just felt like I would lose control with these big companies. One of them wanted to take it and give me 5% royalty. And I was like, so you want me to give it away? Is that what you're telling me?
Yeah.
I know I could have saved a lot of money because of what I know now. I do have a couple other pieces that I'm going to bring behind this, so I'll know the whole process a lot better. I think it will be a lot easier.
Yeah, usually the second time learned a few things a little smoother. And then how are you thinking about sales distribution now that you've got it to market, you've got it out there? You mentioned keeping control. A lot of times this is the time to make a decision on, do you go direct for sales distribution? Do you go through a distributor? It seems like you're kind of getting out there on your own. That first sale, you said you were there and what you gave
Right.
them your only demo version, I think you
Yeah.
said.
Yeah, right. He liked it so much that he wanted to keep it for a week, and I couldn't say no because he just bought a bunch of them. So,
Yeah. So now you're no
so I
demo.
I couldn't do any more demos, but he did send it back. But
Okay.
he was going from our meeting. He was going to a hospital and then a rehab center. So
Oh, okay.
and he wanted to show them, so I couldn't say no. I have a handful of other smaller distributors as well. People are interested in selling something new.
Yeah.
Especially when they see it. I think everybody that's seen it in person was kind of blown away. I went to just driving around in the suburbs, just kind of spur of the moment kind of thing. And I stopped in 4 different medical equipment companies, and 3 of them said they want to sell. So that's not bad.
No, that's not.
I'll take it.
Yeah, yeah, yeah. It seems like this space has been looking for some innovation, and there just hasn't been any innovation. And
Right.
you've put the energy into effort into doing that.
What's great about this Adapt Health is that, they're huge. Like I say, they got 675 locations around the country. And, they'll be doing all the advertising and stuff. So, and that's what, right now, that's what it's about, is getting the word out and letting people know that there's something better out there.
Yeah, and on that note, just as we're kind of getting down to wrapping up here, how do people find that, or somebody say somebody is taking care of an elderly, parent or relative at home? Like, where do they look you up?
They could go to perichair.com.
Okay.
That's PERI.com. They can buy it right off my website.
Oh, okay. Perfect.
And there's pictures, there's videos. It takes about a couple minutes to put together. It's 9 C clips that put the chair together. There's no tools or anything needed. It's an easy setup.
Super simple. And it sounds like you're pretty active on LinkedIn. People can also follow you or your journey
Correct.
on as well.
Correct. Yeah.
Okay. Perfect. Well, Vince, I'm excited for you. The long journey, gotten down to the end here, getting shipment in and start to get this out there. Yeah, I'm excited to see where this takes you next.
See,
Thanks so much for your time.
I appreciate people like you. See, that's what keeps me going.
Yeah, I appreciate it too. I mean, I had a lot of people maybe haven't had this experience. I had 2 elderly grandparents in the house, and I interview a lot of people with, in medical industry or biotech, but your story was just really interesting, and you had a unique problem that you solved, and it takes a lot to get it to the place that you have gotten it now. So it's it's an impressive story, and innovation. It was ripe for innovation. It just needed somebody to do it, and that's not easy. So
no, it's not. But I look at demographics. The amount of boomers that are retiring every day. How aging our generation, the demographics are changing. And I think more people want to stay home in their own home. The idea was, when I was building it, was, for people that were taking care of each other. So how could they take care of themselves longer and a little safer? And then it went to the caregiver, because they're going to eventually need a caregiver, right? So how can they make it easier? And that's, the whole concept developed from there.
Perfect. Yeah, everybody go check out Vince's website. If you watch the video, it makes a lot more sense. It's pretty simple. Yeah, I'm super visual. So watching it, seeing it, it makes sense how it can take place of all these pieces and just be a much safer and more pleasant experience for the caregiver and for the person experiencing the care. So thanks so much, Vince.
Thank you, Chris.
Have a great rest of your day.
You as well. Thank you very much.
You've been listening to Stories in Life Sciences, sponsored by MedAccess AI, where we explore people, ideas, and breakthroughs shaping the future of biotech and healthcare innovation. To learn more, visit medaccessai.org and subscribe on YouTube to watch the full conversations and new episodes as they launch. I'm Christopher Wilson. Thanks for joining us. Until next time, keep shaping the future one story at a time.